Hello, hello, hello. I'm here to talk to you guys about Medicare, give you a nice 40,000 foot overview. If you are brand new to Medicare and need to learn a lot more, there is a separate video that I have available. But this one is if you've been on Medicare for a while and just need a nice kind of overview, kind of a refresher. Without further ado, let me share my screen. So, a little bit about me. My name is Tim Gustafson. I've been in the insurance business since 2005, and I help retirees with the four main staples of retirement, being Medicare, life insurance, long-term care options, tax-deferred asset protection. I'm not a financial advisor. I do help people get in those programs where you participate in the gains of the market and never the losses. Been an absolute godsend for a lot of my clients. A little bit about me. I've got an absolutely beautiful wife. You can see her there. I've got two awesome kids, and I've got two of the world's most okayest dogs. That's probably a lie. One's got Tourette's, and one probably isn't a very good cat, but we just love him to death anyway. And then two quotes, just to kind of give you an idea who you're going to be dealing with is one, those with good intentions make promises, those with good character keep them. So I do everything I can to say what I do and do what I say. I'm far from perfect, but that is a standard I do try to live my life by. And then the other one is I try to live my life so that those that know me but don't know Christ want to know Christ simply because they know me. That is a powerful statement. That is, again, a very high standard of that I kind of keep myself to. Far from perfect, but again, I do my best. So with Medicare, the first step is getting Medicare A and B. This is the part you get through the government. If you are already drawing Social Security, there's absolutely no work required on your end. It's automatic, no action required. If you are not drawing Social Security yet, you can go to ssa.gov. You can call it Medicare. You can go to the Social Security office. There's a paper application I do have on my website. If you have delayed Medicare because you're still working and have credible coverage through an employer, through your spouse's employer, there is an extra step. There's a credible coverage form as well. That's on my website. Be happy to go over that in more detail with you, kind of on a one-on-one basis. After you get that, you kind of have the decision time. You can go with original Medicare and a supplement plus a prescription drug plan to cover your Medicare, or you can go with one of those Medicare Advantage options. I'm going to kind of break those down so you kind of know exactly what you're getting into. A lot of people are concerned about the cost. So with Medicare Part A, as long as you work 40 quarters or 10 years, there's absolutely no premium whatsoever for that. Medicare Part B as in boy, the standard premium for 2023 is 164.90. There is an adjustment if you are blessed with a higher retirement income listed there. And then same thing with the prescription drug plan. The medium price is 34.71, and it is also adjusted based on your income as well. So without further ado, let me just kind of get right into the A, B, C's, and D's of Medicare. So with Medicare Part A, again, that is the hospital benefit that covers you in the hospital for days 1 through 60. It's a pretty hefty deductible at $1,600, and that covers you for the first 60 days. Whether you're in there for one or all the way through 60. After 60 days, there's a per diem. That's pretty rare to get that far. It does cover limited home health care, hospice. And once again, as long as you or your legally married spouse work for 40 quarters or 10 years, there's absolutely no premium for you. Medicare Part B is all things medical. So doctors, specialists, casts, splints, x-rays, surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, chemotherapy, any drugs administered to you through an IV or syringe. I'm sure I'm forgetting a thing or two, but hopefully you guys get the point. And with this, there is a pretty reasonable annual deductible. It's $226, and that is for all of those services combined. That's not per service or anything like that. And that is an annual deductible. So even if you get aged into Medicare like in December, it is not prorated. You do have to satisfy that 226 deductible. Before Medicare starts paying 80, you're responsible for 20. Medicare Part C is a little bit different. So Medicare Part C are these advantage plans. These are like HMO and PPO type plans. Kind of the history of these is you had Medicare Part A and B, you have to pay the deductible to 20%. Well, 20% of what? The doctor bills one amount, Medicare approves another. You would really never know what your out-of-pocket expense would be per service rendered. So these private companies got together and they go, okay, we went to the government and said, we got a great idea. Why don't you pay us to take over as primary? And we'll essentially have our clients sign a contract with us that rather than paying 20% of whatever number gets approved, we're going to spell it out. And, for a primary care doctor, it'd be a zero copay. For a specialist, it'd be a $25 copay. For an MRI, it'd be a $150 flat copay. Something of that nature. I'm just making those numbers up just for an example. We'll get into more detail on that, probably more on a one-on-one basis with you. But that's kind of the history. So rather than having these obscure 20% of question mark numbers for out of pocket expense, you sign a contract with that company and it tells you exactly what you would be responsible for as you use it. And then your prescription drug plan is your Part D, and it breaks down the drugs into those 5 different tiers: your preferred generic, non-preferred generic, your brand name, non-preferred brand name, your specialty. There's a standard formula. There's not one plan that's actually through Medicare. They're all offered through private companies, but they all have a deductible and then an initial coverage period and then a donut hole or coverage gap, and then you have catastrophic coverage. Again, more details probably necessary in our one-on-one appointment. And then for Medicare, this is kind of my cheat sheet. This is kind of, you kind of combine, compare the Advantage to the supplement. I get asked all the time, well, Tim, which one's best? Well, the answer is, as long as you understand the coverage, there is no wrong answer. Both can work for you. But with the Advantage plans, there's typically no or a very low additional premium. New to 2023, there's even some buybacks where they'll actually pay a portion of your Medicare Part B premium for you if you are a very healthy individual. Um, and then, a lot of times I say very healthy because if they pay you a portion of that Medicare Part B, that 164.90 that gets deducted from your Social Security, typically it's going to be a little bit higher copays. But you just have to pay copays, so no premium and copays. There is a network of doctors. There's a max out of pocket. So, if something catastrophic happens where you rack up like $20 million worth of medical bills, you don't have to pay copays always and forever. There's a limit to how much your copays could be. There would be no limit to how much the insurance company would have to pay, though. This typically includes your Medicare Part D or your prescription drugs. And these are the ones that you have all those extras. And I know you guys get, you can quit your gym membership and just get your mail every day during certain times of the year. This is where you get all the dental, the vision, the gym memberships, the over the counter items, the hearing aids, all that kind of stuff. So your estimated cost for the year would be your Medicare Part B premium plus an Advantage plan if there is any, or they may even reduce your Medicare Part B premium, and then just whatever copays you have for the year. Supplements a little bit different. With this, you do pay an additional premium. However, there are no copays. There's no network or referrals would ever be necessary. Then out-of-pocket expense would just be your premium plus your Medicare Part B, as in boy, that $226 deductible. This does not include a Part D plan, so you would have to get a separate prescription drug plan. And then there's usually no extras, no dental or vision or gym memberships or any of that kind of stuff is typically included. And as long as as far as out-of-pocket expense, you're looking at your Medicare Part B premium, that 164.90, plus your supplement premium, which can be anywhere from $100 to $200, depending on male, female age. And then your Part D premium, which again, typical cost is about $35, but they can range anywhere from like $7 to maybe even $100 a month. So hopefully that explains Medicare, and looking forward to meeting you for our one-on-one appointment. Thank you so much, and God bless.